I'm Amari. I'm going to be going over the bones of the body for the oral exam, starting off with your frontal bone, your parietal bone, your temporal bone, your occipital bone, your sphenoid bone, your ethmoid bone, your mandible bone, your maxilla, your plantain bone, your nasal bone, your lacrimal bone, your vomer, your inferior nasal, moving down to your only throat bone, your hyoid bone, your shoulder bones include your scapula, also known as your shoulder blade, your clavicle, also known as your collarbone. Moving down to your chest bones, you have 1 sternum and 25 ribs. Moving down to your vertebral bones, your cervical vertebrae, your thoracical vertebrae, your lumbar vertebrae, your sacral vertebrae, your coccygeal vertebrae, moving down to your arm and forearms, moving down to your humerus, radius, and ulna, moving down to your hand, your scaphoid bone, your lunate bone, your triangular bone, your pisiform bone, your trapezium bone, your trapezoid bone, your capitate bone, your hamate bone, your metacarpal bone, your proximal phalange, your intermediate phalange, your distal phalange, moving down to your pelvic bones, your hip bone, and moving down to your pelvis, moving down to your legs, you have your femur, your patella, your tibia, your fibula. Moving down to your foot bones, you have your tarsal bones. Moving down to your heel, you have your calenus. Moving down to your talus, and moving down to your navicular bone, your medial cuneiform bone, your intermediate, your lateral, your cubital bone, your metatarsal bone, moving all the way down to your proximal phalanges, your intermediate phalanges, and your distal phalanges.